another episode of Coffee Talk with Encore. Today, we'll be sharing some helpful tips and information on the topic of coding Section GG's upper body and lower body dressing item sets. Well, our goal as clinicians is to help our patients really regain their independence. And with that responsibility comes the necessity of documenting our skills and accurately coding our patients' level of self-performance. We're hoping that today's Coffee Talk provides everyone with useful information and reminders as we're preparing for the GG coding updates that go into effect on October 1st.
Yes, so to kind of just summarize and review the definitions of what we're looking at when we're assessing upper body dressing and lower body dressing. So when we're talking about upper body dressing, we're assessing the patient's ability to dress and undress above their waist. So this does include fasteners if there's any on their clothing. And it does actually also include the donning of a back brace or slings if those items are above their waist area as well. And then on the flip side for lower body dressing, this includes the patient's ability to dress and undress below their waist. So again, it does include those fasteners if there are any, but this particular area does not include footwear. So if you have been a therapist and have been coding these areas for a while, you know that donning and doffing socks and footwear is its own separate category. So keep in mind that those coding definitions that come straight from the RII manual, whether it's a not assessed area or you were able to assess it, make sure that you're using the most appropriate and accurate coding definition to really capture that clinical picture of each patient that you see. So Becky, can you give us any insight into any special coding that we should kind of keep in mind when we're talking about upper and lower body dressing?
Yeah, so as always, the REI manual gets a little more technical than those brief definitions, right? So when we talk about upper body dressing, they're very clear that this is not the patient putting on or taking off a patient gown. So if they're staying in their gown all the time and you're not actually getting them dressed into clothing, that's going to be one of those times where we code that not assessed. And then we have to decide why we're doing it. Is it that it's medically inappropriate for us to get the patient dressed because of equipment or something going on? Or is it just that the patient doesn't like to get dressed and then it's more of a refusal? But it is getting clothing on and off of their upper body, so not a patient gown. There has been a change in the coding guidance for upper and lower body dressing, and it has to do with those fasteners. So up until September 30th, if you're coding that patient's ADL and you're looking at their ability to do their upper body and lower body dressing, if they're just needing assistance with those fasteners, the guidance says to code it under that supervision touching assist. The new RII manual, as of October 1st, tells us if they need that assistance with the fasteners, and we're supposed to look at their level of assistance for the entire activity. So if they do need that assistance with fasteners, it is going to push them over into that partial moderate because it is physical assistance. So that key change is coming October 1st. The other area is a little bit of clarification with our compression garments. So lower body dressing, it does mention elastic sleeves, lower extremity bracing, that all goes into lower body dressing, or prosthetics, putting on those gel liners under lower body dressing. But they did clarify that compression socks, because they include that foot, go under donning and doffing footwear. So even our thigh-high TED stockings, because they include that heel and toe, are going to go into that footwear. So just a little tweak.
When we're coding upper body and lower body dressing, it's just like every other section of Section GG, where we want to make sure that we're coding and thinking about the usual performance at the time of admission and the time of discharge. So it's not the worst that they did, it's not the best that they did, it's just how they usually do. It's important also that we're making sure that we're capturing that performance before any sort of intervention from the facility. So before a therapy intervention, before anything that nursing is intervening with, any sort of intervention in the facility, because we really want to get a good, accurate picture of how they function when they first came into the building in order for us to get accurate outcome scores. So if we're providing intervention, if we're saying, oh no, try this technique, and then we're coding Section GG for upper body dressing, they could have improved with that intervention, and we're not going to get credit, I guess, for how they truly came in the facility. So it's important that we're looking at their function before any sort of intervention. Now, accuracy, we've talked about this, is key with section GG. We want to make sure that our outcomes are correct. Our outcomes are available for people to look at. They can see how our patients achieved their goals with therapy, how much progression they made. And so it's important, especially when people are looking at choosing a facility for their loved one, they're going to be looking at how well our therapy outcomes are. It's also important that it's coded correctly because this information does go to CMS. This gets reported to the government. The government is looking at the data that we're submitting, and it has a big impact on how much the facility is reimbursed for caring for these residents. So if we are giving them inaccurate coding, they could be receiving too much payment for caring for the residents, or on the other side, we could be kind of impacting their ability to be receiving enough compensation for caring for the level of complexity that this patient requires. So accuracy is super, super key with section GG. It's very important.
Well, one additional tip I did want to share today is for those who are interested in learning more on this topic. CMS has created some really good trainings and they can be found on YouTube. So you never know what you can find on YouTube. It's not just, fun skits and videos. It's really CMS videos. It's got some really great learning resources for sure. So I really highly recommend that everybody go in and take a look. Well, I would like to thank everyone for joining us today and listening in to hear our discussion on accurately coding section GG's upper body and lower body dressing item sets. And we look forward to having everyone tune in again for our next episode of Coffee Talk with Encore.